I'm not really sure how to introduce this video to you, so I'm just going to get straight to the point. I'm showing you a report from the World Health Organization released on the 2nd of September 2025. This is what it says. Over 1 billion people living with mental health conditions. Services require urgent scale up. This is from their news release Geneva report. We're going to go through this report together. This is quite urgent. More than 1 billion people are living with mental health disorders, according to new data released by the World Health Organization, with conditions such as anxiety and depression inflicting immense human and economic tolls. While many countries have bolstered their mental health policies and programs, greater investment and action are needed globally to scale up services to protect and promote people's mental health. Mental health conditions such as depression and anxiety are highly prevalent in all countries and communities, affecting people of all ages and income levels. They represent the second biggest reason for long-term disability, contributing to loss of healthy life. The new findings, published in 2 reports, World Mental Health Today and Mental Health Atlas 2024, highlight some areas of progress while exposing significant gaps in addressing mental health conditions worldwide. The report serves as critical tools to inform national strategies and shape global dialogue ahead of the 2025 United Nations High-Level Meeting on Non-Communicable Diseases and Promotion of Mental Health and Wellbeing, taking place in New York on the 25th of September 2025. Transforming mental health services is one of the most pressing public health challenges, said Dr. Tridos. I'm going to butcher this person's name, so I'm not going to try. WHO Director General. Investing in mental health means investing in people, communities, and economies, an investment no country can afford to neglect. Every government and every leader has a responsibility to act with urgency and to ensure that mental health care is treated not as a privilege, but as a basic right for all. Key data from World Mental Health Today. The report shows that while prevalence of mental health disorders can vary by sex, women are disproportionately impacted overall. Anxiety and depressive disorders are the most common types of mental health disorders among both men and women. I can't show this word or say this word on screen as I risk getting the video flagged, so I'm just going to scribble that out. Remains a devastating outcome, claiming an estimated 727,000 lives in 2021 alone. It is a leading cause of, I'm not going to say that word, among young people across all countries and socio-economic contexts. Despite global efforts, progress in reducing is too low to meet the United Nations Sustainable Development Goal of 1/3 reduction in rates by 2030. On the current trajectory, only a 12% reduction will be achieved by that deadline. The economic impact of mental health disorders is staggering. These findings underscore the urgent need for sustained investment, stronger prioritization, and multi-sectoral collaboration to expand access to mental health care, reduce stigma, and tackle the root causes of mental health conditions. Key findings from the 2024 Mental Health Atlas. Since 2020, countries have been making significant strides in strengthening their mental health policies and planning. Many have updated their policies, adopted rights-based approaches, and enhanced preparedness for mental health and psychosocial support during health emergencies. However, this momentum has not translated into legal reform. Fewer countries have adopted or enforced rights-based mental health legislation, and only 45% of countries elevated laws in full compliance with international human rights standards. The report reveals a concerning stagnation in mental health investment. Median government spending on mental health remains at just 2% of total health budgets, unchanged since 2017. Disparities between countries are stark. While high-income countries spend up to $65 per person on mental health, low-income countries spend as little as, less than a dollar. The global median number of mental health workers stands at 13 per 100,000 people, with extreme shortages in low and middle income countries. Reform and development of mental health services is progressing slowly. Fewer than 10% of countries have fully transitioned to community-based care models, with most countries still in the early stages of transition. Inpatient care continues to rely heavily on psychiatric hospitals, while nearly half of admissions occurring involuntarily and 20% lasting longer than a year. Integration of mental health into primary care is advancing, with 71% of countries meeting at least 3 of the 5 WHO criteria. However, data gaps remain. Only 22 countries provided sufficient data to estimate service coverage for psychosis. In low-income countries, fewer than 10% of affected individuals receive care, compared to over 50% in high-income nations, highlighting an urgent need to expand access and strengthen service delivery. Encouragingly, most countries report having functional mental health promotion initiatives such as early childhood development, school-based mental health, and, can't say this word, prevention programs. Over 80% of countries now offer mental health and psychosocial support as part of emergency responses, up from 39% in 2020. Outpatient mental health services and telehealth are becoming more available, though access remains uneven. Global calls to scale up action on mental health. While there has been some encouraging developments, latest data shows that countries remain far off of track to achieve the targets set by WHO in the Comprehensive Mental Health Action Plan. WHO calls on governments and global partners to urgently intensify efforts towards systemic transformation of mental health systems worldwide. This includes equitable financing of mental health services, legal and policy reform to uphold human rights, sustained investment in the mental health workforce, and expansion of community-based, person-centered care. I'm going to end the video shortly. I just wanted to provide a few final notes. I'm making this video to raise awareness about this staggering state of mental health on the planet. Over 1 billion people. The World Health Organization estimates that by 2030, depression will be the leading cause of disability across the entire planet. It will take over from cardiovascular health issues such as heart attack and diabetes. I just want to say that if you or a friend is living with a mental health disorder, please seek help. The principal practitioners that you need to look for are a psychologist or a psychiatrist. They will help you the most. There is help available. Please seek it. I'm going to end the video here. I'm going to link the report in the comments section if anybody wants to read the full report. Content warning: when you read the full report, there are keywords that people might find distressing, so read the report with caution. Thank you for watching.